My dad died 4 days after starting hospice. There wasn't enough time to take advantage of all the emotional and logistical support. We could have used that help. Everyone can at that time.
When you start to think about hospice, it's common to have a lot of questions and concerns. That may be because hospice care only becomes an option when it's clear that trying to cure disease or prolong life is doing more harm than good. Giving up hope for a cure can be hard, but hospice can offer a different sense of hope, to live life to the fullest with the people you love. So, what does hospice look like? It's a combination of medical care to control your pain and other symptoms, as well as emotional and spiritual support for you and the people you love. It's most common to receive hospice care in your home, where a family member or loved one looks after you. But sometimes, hospice care is provided in a hospice center, a residential care facility, or a hospital. You'll have a hospice team made up of a doctor, nurses, a social worker, and others. Someone from the team will visit 1 or more times a week, depending on your needs.
My partner's biggest concern was getting to know new doctors and nurses. She agreed to hospice only after she knew her doctor could stay involved. It turns out she fell in love with her new social worker, who seemed to know just what to say and do.
Hospice also provides a 24-hour help number that you can call at any time, and your family caregiver will get the equipment and support they need to care for you. Things like a hospital bed or a wheelchair, and training on how to give medicines, move you safely, and offer comfort. Many healthcare plans cover some or all of the costs of hospice. You can ask any hospice program to research what your insurance covers. Some people actually live longer on hospice, and you can choose to stop hospice at any time and then re-enroll again in the future. It's common to wonder when the right time to transition to hospice is. Often, more time on hospice means a better quality of life, and when the time comes, a more peaceful death.
Hospice fulfilled all of Mom's requests, including bringing in a chaplain and playing classical music. They provided loving, attentive care and showed us how to do the same. Plus, she got to be in her home, which is where she always wanted to be.